People with chronic conditions like arthritis need more than medicine to help them with the day-to-day tasks. I sat down with two experts who say it starts with support. There's that S word.
It's important to me because it gives me a reason for why I have gone through what I have passed through, so that if someone else says, oh, I'm going to have my knee replaced, my life is going to be over, I can go, I've been through it, you can do it too. But I've felt it's emotional support. I've had a few people that were near suicide because they couldn't deal with the disease, and I was able to encourage them and connect them with correct health professionals to overcome their depression.
Absolutely. And doctor, I mean, that support, again.
It's really fabulous because people feel isolated and alone if they have arthritis, if they have a different condition, and they all feel that also their life is going to be over, they're not going to be able to do what they have to do. And Linda shows them, no, it's not. And even if you have problems, you can improve the problems, you can get over it, you can move on. Even if you have a joint replacement, you can still function and still do what you have to do.
And we're going to get more into the peer group, but I first want to know, Linda, how you and Dr. Weitz got connected. When did you first meet?
I was already doing volunteer work for a pharmaceutical company named Searle, and I was a Searle patient partner, which meant I went around and gave lectures to primary care doctors on what a person with arthritis was, that it wasn't someone's grandma.
Right.
And he was doing the drug study for Celebrex, and I was excited that we could have drugs that weren't taking 20 of them a day and not chained down to, it's like, wow, only 2 a day? But this is back when the newest NSAID was the hot thing in arthritis care.
Right.
It's now old hat.
It's now, doctor, for you as well, are there many rheumatologists out there that deal with this disease or this condition?
There are a lot, but there aren't enough.
There aren't enough.
That's the problem. There's a shortage of rheumatologists, and as the population is aging and we need more rheumatologists, they aren't being trained. So that's a big problem. And we're trying to address that through the American College of Rheumatology and also the Florida Society of Rheumatology.
And then when did you get diagnosed with RA?
I truly came down with RA when I was 17 years old. It gradually impacted my life. I had more and more joint pain. It was triggered by the Asiatic flu. And when I was a college student, I tried my best to ignore my symptoms. If I showed up at a doctor, I was told it was either my shoes or I was just a whiny female, and to stop bothering these people.
Oh my goodness, Linda.
But it typically takes 4 to 5 years to get a correct diagnosis.
So not one doctor that you saw ever thought this could be some form of arthritis?
Not for the first 5 years. It was like, it's your shoes, you know, or you need this exercise, or we're going to sell you arch supports. They always had some, but to blame me. And then when I had an acute attack when I was 23, they did the blood work, and the orthopedic surgeon said, whoa, I can't treat you. And I still had to wait 2 months to see a rheumatologist.
And he couldn't treat you because it was so advanced?
He was an orthopedic surgeon. He knew that treating rheumatology was not anything he could deal with. He couldn't just give me a cortisone injection and have it go away.
Now, when you said you had an attack, what does that mean? What happened to you?
An acute flare. It woke me up at 2 o'clock in the morning. It felt like an elephant was sitting on my hand. And there was no getting away from the pain. It was like my hand is being crushed. I'm not doing anything. It woke me up from a sound sleep.
And does that usually happen, Dr. Weitz?
You can have acute flares, especially when Linda, we were talking about that, because there really wasn't good treatment. We thought there was, but there wasn't really good treatment. And all of a sudden the arthritis may flare, acute inflammation, red, hot, tender, swollen, can't use a joint, can't use her hand. It does happen.
Wow. Now, Linda, you actually said your father suffered from rheumatoid arthritis as well.
That's true. There's basically a genetic predisposition for coming down with any of the autoimmune diseases. And as a little girl, my father was suddenly hit by rheumatoid arthritis. He actually, I'll tell you a little bit more about the story because it's applicable for today. And that's the fact he was delivering mail on basically on a bicycle here in Miami. And my running joke is every person on his mail route had a cure for arthritis.
Right.
Okay? I mean,
everyone always has their ways they try to help.
Okay, but I have to laugh at what he tried. and the fact that every time he tried a special diet, it wasn't just him. The whole family's eating no meat for 3 weeks. Oh, the whole family is having apple cider vinegar instead of orange juice for breakfast. So every time someone comes up with a cure, he tried the vinegar, he tried mustard plasters with ultraviolet heat lamps, bee stings, bone broth.
Wow, but I feel like at that point, probably with the pain and the swelling, you're just willing to try anything at this point.
Yeah, well, he went to Jackson, who was in the early stages of forming its rheumatology school. And the most they could do is they gave him very high doses of cortisone. And every time he came up with pain, they gave him more and more cortisone until he ended up, number one, needing, I've got the ATCH, is that the correct name?
ACTH, yes.
What is that, doctor?
It's a hormone that the body makes, the pituitary gland makes it, and it stimulates cortisone production as well as other anti-inflammatory mediators.
Okay.
But his body stopped making enough, so it was daily shots to replace that. He obviously had to go on disability, but on the list of people calling me up, he had copper bracelets, and instead of CBD oil, he had hemp plant extract, which is CBD oil.
CBD
So
oil.
when everyone goes, it's new and improved, and it's like, no, my father tried that.
Have you ever tried the CBG as well?
I'm not, put it this way, I've not tried bee stings, I've not tried mustard plaster.
And bites?
No, bites. I did have a copper bracelet that made an aunt happy when I wore it, because she said, I want to help you. It's like, okay, if it makes you happy, it's not going to hurt me. But the fact that there weren't any treatments really available for him,
Right.
and the cortisone, they didn't know how to regulate it well in his case. The only thing he found for pain relief was whatever kick you get from 4 packs of cigarettes a day.
Right.
And he died of lung cancer.
Unfortunately, oh my God,
So,
I'm so sorry, Linda.
but I'm just saying, it's like, if I smoke one more pack, I can go to sleep at 2 in the morning. But it was that desperation. And the fact I witnessed his desperation. So when people come to my group or people who have called here,
You understand that desperation.
I understand. I saw it, firsthand, but I also knew I didn't want to go through that myself.
If you'd like to learn more about arthritis, download our Health Channel app or check out our website at allhealthtv.com. And remember, if you have a question, reach out. You can send us an email by visiting our website, allhealthtv.com, or give us a call at 855-796-4475.